Tendons connect muscles to bones, and so in athletes, they're using those muscles quickly and forcefully, and so we do see a lot more tendon injuries in athletes, especially in contact sports. The tendons that are most commonly injured are the quadriceps and hamstrings tendons, the Achilles tendon in the foot, the pectoralis major in the chest, and the biceps and triceps tendons. Factors in tendon injuries are overuse, repetitive motion, quick forceful motions, or high-speed contact, such as football players. In this situation, we have to protect them after repair until they can have the same forces on their body. Although tendon injuries are common in athletes, we see different injuries in sports-specific ways. For example, baseball players are going to have a lot more overuse if they're a pitcher or a catcher, whereas the outfielders may rupture a hamstring running. Where in football injuries, because of the forces and the speed involved, we're going to see a lot more of those high-speed injuries. And the athletes can't return to that sport until they can take those sort of forces on their tendons again.